I'm going to be introducing Larry S. Gage. And I want to introduce him by sharing a little story. At the 25th anniversary, five years ago, Larry really made what I thought was a great presentation on the state of public hospitals and the challenges that we were facing. And I love the slides. And he's going to remember this. I came up to him afterwards, and I said, I want to borrow your slides. You know, I want to use them. They were really fantastic. And he's a gentleman, so he let me have his slides. But I sensed a little reluctance on his part because he probably realized that 5 years later, I would turn the tables on him with his own slides. So by way of introduction, I guess I can control it right here. Okay, so Larry used this slide, and those of us who know Larry well can testify to the fact that he is a wine connoisseur. He tried to avoid that the other day when I was talking to him about a wine tasting. But Larry introduced not only myself, but a whole myriad of NAPH members to the joys of vino. And I'm sure that it played an important role in his leadership of NAPH. Larry was a very precocious lad. This is him riding off to Washington, D.C. after completing law school. This brilliant young man had just breezed through his education and was ready to go to Washington and take on battle in the halls of Congress. However, after about 6 months of battling things in Washington, D.C., Larry looked like this. So it matured him quite a bit, but he gained a great deal of experience, and it was during that time that he accomplished a really great deal on behalf of the poor and the uninsured. But Larry was clearly fascinated about the health of Americans and how important it was. And he wanted to get down to the real root of the problems that exist in the American healthcare system. And so he quickly made a diagnosis that we had a few things to work on in America. And he was not going to despair about what the obvious challenges were to our healthcare system and improving things for all of us. But despite these enormous challenges, Larry was not afraid. And so he went out and started something new to challenge the status quo in healthcare. And NAPH was born. He became our founder. In fact, Larry used his political skills and knowledge to fight on behalf of public hospitals. And we are where we are today because of his efforts. 30 years ago, this was a real challenge because public hospitals were weighed down by a tremendous burden. But Larry took people like Ron Anderson by the hand and pulled them down, and they were able to move forward and progress us to the next stage. And with several others, NAPH, again, is here today and has not only performed great advocacy, but is an influential national organization playing on the national stage. So 5 years ago, Larry set out to share with all of you the problems facing public hospitals today. And it went on and on and on and on. And I'm going to play it as I actually give my formal remarks introducing Larry. But I dare say 5 years later that the problems that Larry outlined 5 years ago, many of them still exist for us as we guide our institutions through these stormy waters. I will now introduce Larry Gage, who will talk about why we needed NAPH in 1981 and still do today. In 1981, Larry founded NAPH and has since served as president. During this period, Larry developed and achieved enactment of Medicare and Medicaid reimbursement reforms that are the economic lifeblood of hospitals serving a disproportionate number of elderly and limited income patients. Larry is also a partner in Ropes and Gray Healthcare Group. He served as Deputy Assistant Secretary for Health Legislation in the Federal Department of Health and Human Services and as a staff counsel to the U.S. Senate Labor and Human Resources Committee. Just as I surprisingly introduced, and he'll remember this too, Larry several years ago at a previous NAPH conference honoring Ron Anderson, let me just say, as I said then, here's Larry.
Thank you very much, Kirk. Has it stopped? Now I know why Pam and Anika kept coming to me saying, "Are you sure you don't have slides? Are you sure you don't have slides?" And I think they were afraid I was going to duplicate. Actually, I decided to stop using slides last year when I read a Dilbert cartoon in which he was trying to figure out what to do with the rest of his life, as he always is. And he said he's decided he's on a mission to become the man who is known for changing the world with his PowerPoint slides. So, once it made it into Dilbert, I decided to retire them. I am just extremely pleased to be here at our 30th anniversary. I'm not sure 5 years ago I thought I would be here, but this is an organization that is so near and dear to everything I've done in my life, going back well before the beginning of NAPH, that I'm not going to turn into a statue here in front of you. I'm not going far, and I'm looking forward to continuing to work with you because of the work you do is absolutely essential. In addition to the fellows, and I think the fellowship program at NAPH is something I look to as one of our supreme accomplishments over the years. It really is the glue that has held NAPH together and created a true national community. And I just wanted to have everybody who is a fellow today and has ever been a fellow in our program to stand up. I would say that's safely half the room, and I think there have been over 500 of you in the course of the 13 or 14 years that this program has been operating. I also want to acknowledge the fact that we invited all of our past board chairs to attend this event, and I think, in fact, easily a dozen of you are here today or present at the meeting. And I just want to acknowledge those who are here. You don't have to stand up. But I want to make sure people know who you are. It goes all the way back to Bob Johnson, one of the 5 founding members of NAPH, back when he ran DC General Hospital. And the list includes Bob Johnson, Bob Sillen, Ron Anderson, Mark Finucane, Doug Bagley, Patty Gabbo, Dan McLaughlin, John O'Brien, Frank Puglisi, Lorraine Brown, John Benz, Gene O'Connell, and of course our current board chair, Kirk Calhoun. That's, if you're a headhunter sitting here in this room, that is an extremely impressive pool of talent and resources, and we are extremely fortunate to have had them as a part of our leadership for the last 30 years. The topic that's listed in the program and that Kurt mentioned was why NAPH was needed in 1981 and why it is still needed today. And often in the past, and I say this to the staff people, both from my law firm and from NAPH, I'm not going to give a long history lesson, which is what I might have done before, but I am going to touch on some of the reasons why NAPH was first created and see what parallels might exist today. NAPH, to a certain extent, grew out of the enactment of Medicare and Medicaid in the mid-1960s, because at that point, a lot of policymakers and observers believed that that was it, wash our hands of the need to provide any further services to these vulnerable populations, and we certainly won't be needing public hospitals anymore. Nothing really could have been further from the truth. In fact, as Uwe Reinhardt and others know, who have observed the programs over the years, Medicare did extend coverage to every eligible American over 65, but until the passage of the drug law several years ago, never really covered more than about 50% of the out-of-pocket costs of the elderly, which meant that low-income elderly patients needed to find other ways to pay their bills or to become eligible for Medicaid. Medicaid was intended to extend coverage to the poor in certain categories of poor, but even Medicaid, with the limited categories that were eligible, never got beyond about 70% coverage of the population it was intended to cover, and that was reached in the mid-1970s. And really, for all practical purposes, even with some expansions of selective coverage and the child health program that was enacted in the late 80s, that program is down around 50%. And in some states, and some of the states represented in this room, I think it's less than 20% of the genuinely poor and uninsured and underinsured who are really still eligible for Medicaid today. So by the late 1970s, many of the public hospitals sitting in this room that were once thought to be unneeded were in fact bursting at the seams with uninsured and underinsured patients, and you were also providing many undercompensated community-wide services like trauma care, burn care, emergency mental health services. And this, of course, has been the mantra of NAPH over the course of our life. In the mid-1970s, the American Hospital Association actually stepped up in light of some of the concerns of public hospital administrators and governing boards around the country, created something called the Section on Public General Hospitals. And also, the Hospital Research and Education Trust was able to obtain a grant from the Kellogg Foundation to fund something called the Commission on the Future of Public General Hospitals. And the Kellogg Commission, as it came to be known, actually produced an excellent and really quite a comprehensive report in 1977 that found that public hospitals were still very much needed and very much endangered. Unfortunately, the Commission's funding ran out and it was disbanded, and really nothing further was done at the time. And so that really laid the groundwork for some of the members who had been participating in that commission and who had been agitating for greater attention to the problems of public hospitals were ripe for the creation of a new organization. And they were the ones really who came together and while I was still working in government in the Carter administration, began to talk to me about the need for an organization like NAPH. So it was actually a fairly simple matter to put a small number of them together in a room actually on Capitol Hill, hosted by Congressman Charlie Rangel, who never stopped reminding me that he paid for the lunch, which is one of the things he almost never did. And we came out of that meeting with NAPH.